Welcome to the Explainer. So if you're staring down the barrel of a knee or hip replacement, or maybe you're already right in the thick of recovering from one, you are in exactly the right place. Our goal today is super simple. We're going to demystify post-op recovery. We're basically taking those absolute mountains of medical advice out there and transforming them into a highly manageable, empowering toolkit. You're going to learn exactly how to take back control of your healing so you can actually get back to living your life. Okay, let's dive into this. Here's our roadmap for today. We'll be covering 1. Normal pain or blood clot. 2. Winning the swelling battle. 3. The rice versus meat debate. 4. Fueling your recovery. And finally, number 5, mastering your medications.
All right, section 1, normal pain or blood clot.
It's literally the question every single patient asks at, 2 a.m. when their leg is just throbbing. Is this pain normal or is it something worse? When you've just had major surgery, your body is sounding all sorts of alarms. It's completely valid to feel worried. So let's clearly define what you should expect and what actually requires a 911 call.
Okay, so here's the absolute crucial difference. Typical post-surgical pain, that is totally expected. It's localized right around the surgical area, it's going to decrease gradually over the weeks, and most importantly, it gets better when you use ice and elevate your leg. Even some mild redness and warmth right at the incision, completely normal inflammation. But on the flip side, the symptoms of a blood clot are pretty dramatic. You're looking for a sudden or significantly worsening cramp or soreness that just doesn't improve with rest. The swelling from a blood clot is often really severe, it's generalized in the calf or thigh, and that redness and intense warmth, it'll spread way beyond the surgical site. If you see those sudden, radiating red flags, you literally do not wait. You seek immediate emergency medical attention. But, if it's localized and improving with some ice, you're just experiencing the normal journey of healing.
Moving right along to section 2, winning the swelling battle.
Now, while moderate swelling is just a completely natural part of the healing process, and honestly, it can last anywhere from 3 to 6 months, we don't just have to sit back and take it. One of your greatest weapons against swelling is something brilliantly simple, the ankle pump. Think about it. When you're resting for long periods, blood pools in your lower legs because your heart pumping all by itself just isn't enough to fight gravity. By pointing your toes all the way up towards you and then all the way down away from you, you're actively forcing your calf muscle to contract. That calf muscle acts like a secondary heart. It literally pumps the pooled blood and fluids back up into your bloodstream and returns it to your heart. It takes almost zero effort, but it is an absolute game changer for preventing blood clots and jump-starting your circulation. Alongside those ankle pumps, gravity and compression are your absolute best friends right now. You're going to want to elevate your limb above the level of your heart for about 30 minutes at a time. But listen, here's the critical detail. Prop that leg up with pillows under your knee and calf, not under your ankle and heel. Resting the whole weight of your leg on your heel can actually cause skin problems and pressure sores. Nobody wants that. Second, hit it with ice packs for 15 to 20 minutes several times a day. That one simple step can literally drop inflammation by up to 50%. And finally, make sure to utilize those snug compression bandages or stockings. They maintain constant pressure and keep that circulation moving smoothly.
And this really shows how your daily habits just tie the whole shebang together. Quick pro tip for you, drink 8 glasses of water a day. I know it sounds kind of counterintuitive to add fluid when you're swollen, but hydration directly flushes out excess sodium, and that prevents fluid retention. Second, move within your limits. Try not to sit or stand in one exact position for too long. Make it a point to stand up or just stretch every single hour to keep that blood flowing. And later on in your recovery, once the surgical site is fully healed, some gentle massage can really help stimulate that healthy circulation even more.
All right, let's shift gears to section 3, the rice versus meat debate. So, for decades, the gold standard in orthopedics was rice, right? Rest, ice, compression, and elevation. And hey, while that's still great for minimizing initial swelling, sports science experts are now pointing to meat, movement, exercise, analgesics, and treatment as the superior recovery standard. Here's exactly why this matters. Extended rest actually builds stiff scar tissue. Plus, ice reduces blood flow. Sure, that stops swelling, but it also stops the vital, nutrient-rich blood that your ligaments and tendons desperately need to heal up. The meat protocol argues that guided, gentle movement invites all that nutrient-rich blood right back into the area. It accelerates your recovery and ultimately builds a much stronger, much more flexible joint. Pretty fascinating shift, right?
Which brings us to section 4, fueling your recovery.
So, movement is obviously critical, but what's actually fueling that movement? After a major surgery, food isn't just a diet. It's the essential raw material, the literal building blocks your body desperately needs for tissue repair. Here is your exact timeline for what to eat. 2 to 4 weeks before your surgery, you're building up your reserves with lean proteins and complex carbs. Then, immediately post-op, in those first 24 to 48 hours, your digestive system is going to be super sluggish from the anesthesia. Just stick to clear liquids and the bland brat diet: bananas, rice, applesauce, and toast. But once you hit week 1 and beyond, it is time to build back stronger. You're aiming for 20 to 30 grams of high-quality protein per meal to repair that tissue. And crucially, you need high-fiber foods. Think pears, oats, berries. Why? Because those opioid pain medications you'll probably be taking are notorious for causing pretty severe constipation. Fiber and fluids are your absolute best daily defense against that.
Now, it is just as important to know your dietary saboteurs. You absolutely have to avoid alcohol. It interacts dangerously with your pain meds and it dehydrates you. Skip the highly processed sugary foods too, because they promote inflammation, which is literally the exact opposite of what your swollen joint needs right now. And finally, hold off on taking any unapproved supplements. Common stuff like garlic, ginkgo, ginseng, or even vitamin E can actually increase your risk of bleeding, so definitely clear every single pill with your surgeon first.
Finally, Section 5, Mastering Your Medications.
Let's be real. When you first get home from the hospital, the sheer number of pill bottles sitting on your nightstand can feel incredibly overwhelming. But let's simplify it. Notice how the guidelines on screen kind of visually anchor the strategy here. Managing pain isn't just about popping a pill when it hurts. It is all about staying ahead of the inflammation. Like the experts say, less inflammation equals less swelling, which equals less pain. It's a domino effect.
To actually do that, you've got to clearly separate your medications into 2 mental buckets: scheduled and as needed. Your scheduled medications are the ones working synergistically around the clock. You've got your aspirin to prevent blood clots, Tylenol to control that baseline pain, and anti-inflammatories like Celebrex and Decadron to keep the swelling down. You take these exactly on time, every single time. Then you have your as-needed bucket. These are your rescue meds, right? Zofran for nausea, Senna for constipation, and oxycodone for that severe breakthrough pain. The whole goal of the around-the-clock scheduled meds is to reduce your need for those highly addictive opioids. Keep the scheduled meds steady and just use the as-needed ones sparingly.
Okay, so we've covered a ton today. We went over the critical differences between normal pain and blood clots, the physical strategies to conquer swelling, the modern science of movement, the exact foods to repair your tissue, and exactly how to master your medication schedule. You now have the complete toolkit to actively conquer your recovery journey, rather than just letting it happen to you.
Thank you so much for joining us for this explainer. If you found this toolkit empowering, please engage with the resources on screen. And seriously, don't hesitate to reach out to our clinic for any of your physical therapy and pain relief needs. I want to leave you with this one provocative thought before we go. With everything you've learned today, what step will you take right now to fuel your comeback? We'll see you next time.